My name is Savannah Postway, and I've been researching sports venues in the city's answer to teen loneliness. According to the U.S. Surgeon General, written by Dr. Murthy, 33% of teens are affected by loneliness, or 1 of 3 children. Another statistic from Dr. Murthy is that depression risk has increased by 25 to 30% in the past 10 years. Concurrently, youth sports participation has declined 15 to 20% since 2010, driven by facility shortages and escalating costs, leaving communities without vital avenues for social connection. The primary stimulus that I used was Stimulus 2, or Epidemic of Loneliness and Isolation, the U.S. Surgeon General's advisory on the healing effects of social connection in community, which calls for community solutions like sports venues, and also declares loneliness a national public health crisis, underscoring weakened social fabrics from excessive technology use and declining civic engagement. My secondary source was Stimulus 6, DAD, Ballpark We Live On and Shared Memories, which shows shared memories from sports facilities and illustrates how sports venues cultivate enduring communal ties through shared experiences. These stimulus material led to the inquiry, should cities prioritize preserving local sport venues and community sports programs as tools to reduce loneliness and strengthen social connections among residents? With this question, I came to the solution that cities should prioritize investing in accessible youth sports programs and facilities because regular participation in team-based activities significantly reduces adolescent loneliness, strengthens social connections, and supports long-term mental health outcome. The first compelling reason cities must prioritize youth sports program is recognizing loneliness as a public health epidemic that demands urgent community-level action. The U.S. Department of Health and Human Services explained the stakes, warning that loneliness is far more than just feeling lonely. It poses serious threats to your health and well-being. This evidence reveals loneliness as a psychological danger comparable to smoking 15 cigarettes daily, with adolescents facing heightened vulnerability due to developmental needs for peer connection. The second compelling reason is that participating in organized sports directly lowers mental health risk in adolescents, making youth sports programs an evidence-based intervention that cities cannot ignore. A comprehensive study analyzing data from over 11,000 U.S. children and adolescents report that children participating in organized sports had 10 to 19% lower odds of mental health difficulties. These statistically significant results demonstrate that sports engagement delivers measurable mental health benefits, with team sports showing particularly strong effects due to their social components. The third compelling reason is that while organized sports clearly reduce mental health risk in adolescents, the evidence also shows that inactivity itself increases loneliness, making participation even more crucial. Here's a graph of the Figure 1 scientific report from Nature that shows the inactivity of the adolescents have done in the past couple weeks, blue being boys and red being girls. The Norwegian Hunt study provides compelling longitudinal data, finding that physically inactive adolescents had a higher risk of increased loneliness. This research tracks teens over time, revealing that lack of physical activity creates a vicious cycle where isolation breeds more isolation, particularly during periods of social disruption like pandemics or urban disconnection. The alternative solutions that I come up with were other sports programs and competitive sports. The pro for other sport programs is that it's already being used, as a systematic review found that youth sports and sport-based mental health programs are already being used in schools and communities, including PYD, Sport Mentorship Program, and other sport-based interventions, and these are proving to be effective. A con, though, is the cost blocks access, and the American Survey Center states that cost can be a huge barrier to youth sports participation, and this means that without city support, many teens will still be left out. My other alternative solution was competitive sports and implementing them into the community. And a pro is that they will have their mental health will improve due to being in community with people around their age. But according to Dr. Lee, in the psychological effects of competitive sports on young athletes, the time commitment required for competitive sports can lead to missed social activities, leading to feelings of loneliness and disconnection. Another problem is that if the competitive sport becomes too intense or stressful, depression and anxiety rates can actually increase. So while sport programs can help, they only work well when they are accessible, balanced, and community-based. While investing in youth sports facilities addresses teen loneliness effectively, the solution faces notable limitations that must be acknowledged. One is that cities often struggle with high implementation costs due to critical shortages of athletic fields amid growing youth sports demand, which strains limited resources, according to the Youth Sports Business Report. Additionally, unequal access persists for low-income or rural youth who may still encounter transportation, time, or cultural barriers even with the new facilities. For the refutation, according to Hoffman, a researcher for Google, cities can counter higher costs through strategic partnerships and grants using strong ROI or returns on investment via healthier communities and reduced healthcare expenses. For access issues, targeted subsidies, free transportation, and inclusive programming have proven effective as successful youth sports initiatives has successfully increased participation among low-income families. These responses ensure the solution remain practicable, and equitable. In conclusion, cities must prioritize accessible youth sports programs and facilities because team-based activities significantly reduces adolescent loneliness, strengthens social connections, and supports long-term mental health. By choosing investment over inaction, cities don't merely construct facilities, they construct hope, resilience, and futures rooting for together. The choice is clear: build sports programs now or pay the irreplaceable cost of a lost generation. Here, we're excited, and thank you for listening.
Thank you so much. Okay, so some follow-up questions for you. Did your research go in a different direction than you originally planned?
Not really. I stuck with my original plan was to go into the mental health of athletes and what could be better for them, and the solution I came up with was a bit different than I suspected, because I thought that we could just put them together and be like, wow, that this can work if they're just in a community. But with athletes specifically, the sport community and sport venues are the better option. But my overall research didn't go in a different direction than I originally planned it to.
Thank you. And one more question. What do you think the implications of your findings are for your community?
The implications for the findings of my community is that that our community first of all already has a lot of areas where we can go to sports communities and venues, but a lot of people don't take up the opportunity because they either think they won't make it or they don't think the people will like them. And so I think that we could just have different age groups with different people that and more sports for people to excel at, so they can all strive for something that they want to do and strive and go with people that they want to be with instead of being on a team that you might not like and things like that.
Okay, thank you so much.